So you've probably seen the headlines. Saturday morning, May 17th, just before 11 a.m. out in California, a really big explosion at the American Reproductive Center in Palm Springs. That's a fertility clinic.
Yes. And it's grim news because it wasn't some kind of accident. Palm Springs Mayor Rhonda Hart and also Mike Villegas, the police spokesperson, they've both confirmed it was a bomb. They're calling it an, quote, intentional act of violence.
And the location is significant, too. North Indian Canyon Drive, near Istacheva Drive. There are, several medical places right there. Desert Regional Medical Center is right near the American Reproductive Center.
Yeah, the clinic actually put out a statement confirming that a vehicle exploded right there in their parking lot.
And tragically, someone was killed. Law enforcement sources, they told ABC News the person who died is believed to be the suspect.
Which is just awful. And there was a witness who apparently saw human remains at the scene. Really disturbing stuff.
Yeah, the description of the blast sounds, massive. This witness said the car was blown clear across 4 lanes, landed in the hospital parking lot, basically just the burning frame and wheels left.
So now, obviously, there's a major investigation going on. The U.S. Attorney's Office, spokesperson Bill Asaley's office, confirmed the FBI is involved, ATF 2, Bureau of Alcohol, Tobacco, Firearms, and Explosives. They're trying to figure out exactly what happened and why.
You know, amidst all this horror, the clinic administrator, Abdallah, put out a statement. He said, thankfully, no patients were actually there at the time.
Which is, a small mercy in all this.
Mm-hmm.
He also expressed, how heartbroken they are and sent condolences.
He really emphasized their core mission, helping build families. And he talked about sticking to their values, hope, healing, community, compassion, even after something like this.
Absolutely. It speaks volumes about their resilience, really.
But this event in Palm Springs, as terrible as it is, it's not happening in a vacuum, right? This deep dive isn't just about Saturday. We kind of have to look at the bigger picture, this long and really troubling history of violence aimed at reproductive health clinics, not just in the U.S., but Canada, too. So, where do we even begin with that?
It's a long history, unfortunately. Decades, really. We're talking about what's generally termed anti-abortion violence. Basically, violence aimed at people or places providing abortion services.
Right. And there was an attempt to address this legally, wasn't there? The FACE Act, Freedom of Access to Clinic Entrances Act, back in 94.
Exactly. 1994. The whole point was to protect clinics, staff, patients from, violence, threats, assault, vandalism, even just blocking the entrance.
And it's important to understand, you mentioned this, it's not just abortion clinics, right? The FACE Act covers, all pregnancy-related medical clinics and places of worship, too.
That's right. It's broader protection. But despite that law being on the books for, 30 years now?
Yeah.
The U.S. has still seen just a horrific number of murders at these clinics, at least 11 people killed. And it wasn't just doctors, clinic staff, security guards, even volunteer escorts.
And a lot of that was concentrated in the 90s, wasn't it? That seems like a particularly rough period.
It really was.
Yeah.
1993, Dr. David Gunn, Pensacola, Florida, he was shot and killed during a protest. And what's really chilling is that his name, his picture, they'd been put on those awful wanted style posters beforehand.
Wow. So they're actively targeting him.
Directly targeting him, yeah. The shooter was caught and convicted.
And then Pensacola again, just a year later?
Yes, 1994. Another doctor, John Britton, and a clinic escort, James Barrett. Both shot dead outside a different clinic there, the Lady Center. The shooter in that case, Paul Hill, was executed. And that same clinic, incredibly, it had been bombed back in 84 and then is bombed again in 2012.
Just relentless attacks on one place.
Yeah. And it wasn't just Florida. December 94, Brookline, Massachusetts. 2 receptionists, Shannon Lowney and Leanne Nichols, killed in attacks on 2 different clinics on the same day. The guy who did it, John Salvi, he confessed. He died in prison later.
Receptionist, just people doing their jobs, not even performing procedures.
Exactly. Then jump forward to 1998, Birmingham, Alabama. A security guard, Robert Sanderson, he was actually an off-duty police officer, killed by a bomb at the clinic. That was Eric Rudolph.
The same Eric Rudolph from the Atlanta Olympics bombing.
The very same one.
Yeah.
He admitted to the clinic bombing, the 97 Atlanta clinic bombing, the Olympics bombing, got multiple life sentences. Shows a connection sometimes to wider extremism.
And later that same year, 98, another doctor.
Dr. Barnett Slepian in Amherst, New York.
Okay.
He provided abortions, shot and killed at home by a sniper. Right in front of his family.
Oh, my God. At home.
Yeah. Just got back from his father's memorial service. And his murder fit a pattern. He was like the 5th doctor in upstate New York or nearby Canada, targeted by snipers in about 5 years.
A targeted campaign? That's terrifying.
Investigators linked it all, this series of shootings. They believe it was James Kopp. He was eventually caught, convicted for Sleepian's murder in 2001. Shows you, this stuff even crossed borders.
And sadly, it didn't stop in the 90s. Dr. George Tiller, 2009?
Right, Wichita, Kansas. Dr. Tiller was shot and killed, unbelievably, while he was serving as an usher at his church on a Sunday morning. And he'd been targeted before shot and wounded back in 1993.
Just relentless harassment and danger for some of these providers.
Absolutely. And then, more recently, 2015, the shooting at the Planned Parenthood in Colorado Springs.
I remember that. Horrific.
3 people killed, several injured. The suspect, Robert Deere, apparently called himself a warrior for the babies, although later he was found incompetent to stand trial. But it shows that kind of extremist mindset fueling the violence.
So beyond the actual murders, which are horrific enough, there's this whole other layer of violence and disruption, right? The National Abortion Federation, NF, they track this stuff.
They do. NANAF is a professional group for abortion providers, and yeah, they've been keeping stats since 1977, U.S. and Canada. And the numbers, well, they paint a pretty bleak picture.
Yeah, I saw some of those figures, like at least 17 attempted murders, 383 death threats, 153 assaults or batteries, people actually wounded, too.
13 people wounded in attacks, yeah. It shows this constant climate of, well, hostility and real fear. And the NAF data covers other things, too, like 100 acid attacks, they call them stink bombs, basically to disrupt things.
Okay.
373 physical invasions of clinics, 41 actual bombings, and get this, 655 anthrax threats. Hoaxes, thankfully, but still.
Yeah, 655, that's staggering. And kidnappings, too.
3 reported kidnappings of providers, yeah.
Can you give some examples of those non-fatal incidents? The kidnapping one sounds particularly terrifying.
Yeah, in 1982, Dr. Hector Zavelas and his wife were kidnapped by a group calling itself the Army of God. Just imagine. And then you had, like, a priest assaulting clinic workers in Huntsville, Alabama in 84. Shows the range of people involved.
And sometimes they don't even catch the person responsible.
Right. There were shootings where people were wounded. Springfield, Missouri in 91, Houston 92, Dr. Carpin. Shots fired into Dr. Christ's home in Kansas in 93. Assailants never caught. Makes you wonder how many others weren't solved.
And we mentioned Dr. Tiller being wounded in 93. Shirley Shannon was convicted for that one. And June Barrett, she was wounded in the same attack that killed her husband and Dr. Britton in 94.
Exactly. It impacts families, colleagues. Then you had Dr. Calvin Jackson stabbed in New Orleans in 96. Dr. David Gandel seriously hurt in a sniper attack, Rochester, New York, 97. And Nurse Emily Lyons, she lost an eye in that 1998 bombing that killed Robert Sanderson. The injuries can be life-altering.
So shifting from violence against people to violence against the buildings themselves. Arson, bombings, vandalism, and F tracks that too, right? Since the late 70s.
Yep, since 77. And the numbers are, well, huge. NAF lists 41 bombings, 173 arsons, 91 attempted bombings or arsons.
Wow.
619 bomb threats, over 1,600 incidents of trespassing, over 1,200 incidents of vandalism. And the New York Times, back in the day, reported over 100 bombings and arsons just between 78 and 93.
So this has been going on for a very long time.
A very long time. The first clinic arson on record was Oregon, 1976. First bombing, Ohio, 78. And it's happened all over the country since then.
And you mentioned Pensacola earlier being hit multiple times. That happens elsewhere, too.
Oh, yeah. Pensacola, Concord, New Hampshire places targeted repeatedly over years. It shows a deliberate effort to shut specific places down.
And it's not just bombs and fire, right? Acid attacks, trespassing, vandalism.
All sorts of property crime. Anything to intimidate, disrupt, make it impossible to operate.
There was that incident in 2000. A priest drove his car into a clinic.
Yeah, Rockford, Illinois. Right after the FDA approved RU-486, the abortion pill. Drove his car in that apparently got out with an axe. Just shows how specific events can sometimes trigger these extreme reactions.
And this hasn't stopped recently either. Arson, vandalism, Molotov cocktails still happening.
Still happening. We continue to see these incidents. Sometimes the motivation is stated very clearly opposition to abortion. The underlying issues haven't gone away.
Let's go back to those anthrax threats you mentioned. 655 incidents. That started around 98.
Yeah, around the time Dr. Sleepian was murdered. The first hoax letters started showing up then. All hoaxes, thankfully, but can you imagine the terror that causes?
Absolutely. Just constant fear and disruption. And wasn't there one person responsible for a huge number of them?
Right. In 2001, especially after the real anthrax attacks happened, this guy Clayton Wagner mailed hoax letters with white powder to like 554 clinics. Just an incredible number. He was caught and convicted in 2003.
So fast forward to now. The Dobbs decision in 2022, overturning Roe v. Wade. That must complicate tracking this violence, right, with so many clinics closing.
Hugely complicates it, especially in the Midwest and South, where many clinics shut down. So comparing year-to-year stats directly is tricky. Fewer clinics operating means potentially fewer reported incidents, but it doesn't mean the threat is gone.
Right, because maybe the clinics that closed were the ones facing the most harassment anyway.
Exactly. Many were in areas with more hostility, historically reporting more incidents. So their closure skews the national numbers downwards, even if the threat level for remaining clinics hasn't changed or has even increased.
And the NF themselves say the numbers are probably higher than reported.
They acknowledge that, yeah. Not every clinic is a NAF member, and even members might not report every single incident. There are lots of reasons for that.
Burnout must be a huge factor, too. Staff are just exhausted, especially now.
Definitely. Clinic staff are under immense pressure post-Dobbs. They might just not have the bandwidth, emotionally or practically, to document and report every instance of harassment. It's worrying when awful behavior starts to feel, well, normalized because people are just worn down.
Does NAF have any recent data, despite the challenges?
They do have some numbers for 2023 and into 2024. They tracked 777 incidents of obstruction, people physically blocking access, and 621 cases of trespassing. Obstruction actually ticked up slightly in 2024 compared to 23, but both are lower than some previous years, likely due to fewer clinics.
And protesters are still a constant presence.
Oh, absolutely. Providers reported seeing something like 128,570 protesters over the last 2 years, and NAF is clear that's probably way lower than the real number. Clinic staff are focused on patients, not counting every protester.
Which brings us back to the FACE Act again. How important is it now?
Still incredibly important. It's a key tool to deter violence and obstruction. NAF actually noted that after some high-profile FACE Act convictions and jail sentences in 2023 and 24, they saw a drop in clinic invasions, people actually going inside to disrupt things.
So enforcement works.
It seems to have a deterrent effect, yeah. But the need for it is ongoing. I mean, just as NAF was finishing their latest report, there was an incident in Wisconsin. 2 people blockaded a clinic, wouldn't leave until police physically removed them. So the tactics persist.
And beyond the direct violence or disruption, the state bans themselves have huge consequences, right? You mentioned clinic closures over 60 in 2023, more this year.
At least 11 more in 2024 so far. And yeah, the impact is massive. People having to travel huge distances, often out of state. The Guttmacher Institute found nearly 1 in 5 abortion patients traveled out of state in 2023. That's double the rate from 2020.
And it causes other problems too, right? Like doctor shortages.
Big time. Doctor shortages, these things called maternal care deserts where there's just no obstetric care nearby, kind of brain drain with doctors leaving restrictive states. There was even a study showing people planning families or moving, or know people who moved, specifically because of abortion bans. It affects everything.
We're also seeing these big organized anti-abortion events like Operation Save America.
Right. They target specific cities each year, bring in lots of activists. This leads to really intense protests, disruption aimed right at local clinics, their staff, loud protests, graphic signs, sometimes even protesting at staff members' homes.
That sounds incredibly stressful and intimidating for the staff.
It is. NAP's security team spends a lot of time monitoring these groups, coordinating with law enforcement, trying to keep clinics and staff safe during these events. It's a huge undertaking.
So for clinics and staff trying to navigate all this, what resources are available? You mentioned the FBI has something.
Yeah, the FBI put together a really useful resource booklet. It's for reproductive health care providers and their staffs. Came out of the National Task Force on Violence Against Healthcare Providers. Lots of practical advice in there.
Like what kind of advice? For securing the clinic itself?
Yeah, basic but crucial stuff. Good deadbolt locks, maybe buzzer systems so you control who comes in. Thinking about perimeter fences. Being really careful about who has keys. Watching out for unexpected visitors or deliveries.
Makes sense. Anything else for the business side?
Managing inventory carefully, especially controlled substances. Having solid emergency plans for different scenarios, fire, bomb threat, active shooter.
Yeah.
And training staff on those plans. They also suggest thinking about on-site security and talking with local police or even the U.S. Marshals beforehand to smooth out emergency responses.
Does it cover personal safety for staff, like at home or online stuff?
It does. Tips for securing your home, being cautious about sharing personal info, and definitely cybersecurity, strong, unique passwords, updating software, being super careful with emails and attachments, the standard but vital digital hygiene.
Okay, and what about if a clinic actually receives a threat? What does the FBI advise then?
Well, first they define a true threat. under the FACE Act, basically.
Sure.
A serious message showing real intent to harm someone or damage the facility. If a threat comes in, the advice is clear. If it seems imminent, call 911 immediately. And crucially, preserve the evidence. If it's online, screenshot it. If it's mail, save everything. If it's a phone call, write down exactly what was said, time, caller ID if possible, and then report it to your local FBI field office so they can investigate.
What about suspicious packages? That's always a concern.
Definitely. The booklet lists indicators. Unexpected delivery, weird address spelling or title, return address doesn't match postmark, too much tape, weird smells, wire showing. The absolute rule is don't touch it, don't move it. Call 911 and let certified bomb techs handle it, period.
And God forbid an active shooter situation.
Yeah, the booklet covers that too. Standard advice. Stay calm, follow police instructions exactly, drop anything you're holding. Hands up, fingers spread, keep them visible, no sudden moves, don't stop to ask questions during evacuation, and the run, hide, fight strategy as a last resort if you're trapped.
The booklet also mentions other laws besides the FACE Act that can be used, right?
Yes, quite a few federal statutes. Things like conspiracy against rights, damage or destruction of property, used in interstate commerce because clinics engage in commerce, use of a firearm in commission of a felony. These all carry serious penalties.
Why have multiple laws? Does it give prosecutors more options?
Exactly. It gives them more tools. Maybe the specific intent needed for a FACE Act violation is hard to prove, but they can prove property destruction affecting interstate commerce. Or the firearms charge adds extra prison time if a gun was involved in another crime.
What are some of the other laws mentioned?
Let's see. Using mails or commerce for bomb threats, making threats across state lines via phone or mail, the Hobbs Act, which covers interference with commerce through threats or violence, the Travel Act, about crossing state lines for racketeering, even using weapons of mass destruction in extreme cases, all potentially carry very heavy sentences.
And who prosecutes these? Is it just federal or state too?
It can be both. Federal, state, local authorities often have concurrent jurisdiction. The booklet notes that U.S. attorneys' offices have to consult with the DOJ's Civil Rights Division on potential FACE Act cases to ensure consistency.
Can individuals sue under the FACE Act too, not just criminal charges?
Yes, that's an important point. The FACE Act allows for civil lawsuits. A person, a clinic, or even the government can sue someone who violates the act. They can seek court orders, injunctions to stop the behavior, and also monetary damages and penalties.
So, tying this all back to the beginning, the bombing in Palm Springs, it's just a brutal reminder that this isn't history, it's ongoing.
Absolutely. A stark, painful reminder. This history is long, it's troubling, and it's clearly not over.
And it highlights how vital the work of law enforcement, FBI, ATF, local police, and groups like the National Abortion Federation really is, protecting providers, trying to ensure people can still access care.
It's crucial work, and it's dealing with such a complex situation, balancing the right to protest, which is fundamental, with the absolute need to keep people safe, providers and patients alike. It's a constant tightrope walk.
So as we wrap up this deep dive, thinking about this long history, the Palm Springs bombing, the current polarized climate, it leaves you with a pretty heavy question. What are the long-term implications of all this for the people trying to provide care and for the people trying to get it? And thinking about solutions, what role should federal law play in protecting these rights and trying to prevent more violence? Something for all of us, I think, to really consider.